There's growing outrage in Minnesota following reports of immigration officers detaining patients inside hospitals. Now, a dozen state lawmakers are calling for a change. Jason Rontala has this report.
The last month or so has been a lot more anxiety driven.
Jeremy Olson is second vice president with the Minnesota Nurses Association and a registered nurse at HCMC. Olson says that anxiety is driven by recent reports of ICE at Minnesota hospitals like his.
Politics should not be right at the bedside.
Last week, healthcare workers and community organizers expressed outrage after Unidos MN reported that ICE was allowed to stay at a patient's bedside for more than 24 hours, alleging a patient was handcuffed to a bed, all without a judicial warrant. A spokesperson for Hennepin Healthcare acknowledged the incident, saying the federal agents left after they were asked for documentation. Now a dozen DFL lawmakers are calling for change.
As someone who takes care of patients in the hospital, I want my patients to feel and be safe.
Liz Bolden is both a nurse and DFL state senator. She says even the potential presence of ICE is a barrier to patients receiving care.
Detaining and really targeting and going after people who are quite ill. There's one example of a gentleman with a rare genetic disorder.
There is a crisis among our Latina and Somali families.
Jana Gerwitz O'Brien is president-elect of the Minnesota American Academy of Pediatrics. She says fear of going to the doctor has led to a rash of appendicitis that should have been treated earlier.
People have been delaying care because of fear that ICE is going to show up at the hospital.
Those dozen lawmakers, including Bolden, are now asking Minnesota hospitals for clear and proactive policies regarding ICE.
And to be having these discussions around what is in the best interest of the patient.
A spokesperson for the Minnesota Hospital Association says protocols are in place for how hospitals manage law enforcement being present in healthcare systems.